Now we'll be coming to the refractive surgery part. I request Professor Colonel Sandeep Gupta to kindly speak on refractive surgery, its place in the armed forces and the requirement.
Thank you so much. The important thing is, again, why have standards? So there is a reason why we have standards for armed forces. The reason is we are deployed, the armed forces are deployed over a wide topography, and the engagements are contact-based. So the chances of trauma in armed forces is very high. So these are the people who are located all over the countryside at places which are inaccessible. And because of risk of trauma, that is why we need to have a different standards for fitness and visual standards, obviously, for these people. Now, most of these guys in a job with the acuity required is very good. So again, one place, having standards is important. Moreover, if you see the locations which they are in, see in high altitude, in jungles, if you see the casualty evacuation is also very difficult, it takes time. And the medical infrastructure is definitely poor in these situations. So these are the one reasons why these guys, they need uncorrected visual acuity of a very high standard. That is why all these standards are there. Now, things to note is most of this manpower is a young, skilled manpower. The government has invested a lot of money in training these people. Another thing which is there is they have a lifelong contractual engagement with the government. And armed forces is probably at this moment the only place where you get pension. So if you see that angle from the government side, that is why the government of India and armed forces have this standards in place. And there is definitely the monetary compensation aspect which comes later when any of these guys, they get injured or they have problems, and then definitely there are legal issues because of this monetary compensation and contract engagement. That is the reason why we have standards. Now, if you see, once you understand this concept of why standards are there, now you'll understand why refractive surgery is not permitted at all at few instances. Like RK is not permitted because obviously the risk of trauma, the risk of corneal rupture is definitely high. Phakic IULs, not permitted. Again, the risk of complications in a young patient is definitely high in such a subgroup of patients. Ortho K, why I put it in red is one thing which is there. A lot of people are doing Ortho K, but definitely Ortho K is not permitted because this is just one way. It's a temporary measure to bypass the standards which have been placed. So this is first thing which has to be noted for people who are doing medical examinations or treatment for these guys. A lot of people in civil will be getting somebody who will be telling them that I'm going into army, please give me something so that I can pass that visual standard or the examination which is there. So I'll just explain what is there. So as already explained, at the level of NDA class 10 plus 12 and equivalent, this is at class 12 level where the kids are at the age of around 16, 17, 18. At this moment, no refractive surgery is permitted. The reason is this is the time when the eyes are still growing, the number may change, and the complications there is regression. So not permitted at 12th level. The next level is at the postgraduate level. Now at this level, the age is around 20, 21. So refractive surgeries, apart from the ones I told earlier, the RKs and the phakic IULs are permitted, but with few caveats, which I'll explain later on. Again, the concept behind having refractive surgery at this age is, most of the times, most of these patients, the eyes are already grown, the number is not progressing, and we assume usually a refractive surgery will be done only when the number is stabilized. So that is how the ethical aspect is there, that usually a refractive surgery is done when the number is stable. So that is what the assumption is. At this level, the number is stabilized, and only then the refractive surgery has been done. Now, again, these are all postgraduate level, the officers, JAG, education, RBC, AMC. Now, these are the people who are less prone to the extremes of postings, as I explained earlier. Also, the chances of trauma, contact engagements are less in these scenarios. So these are the people who are in the education branch, the legal branch, the veterinary corps, army medical corps, the dental corps, and territorial army. Here again, LASIK and equivalent are permitted with few caveats. AFMC, again, the age group is 16, 17, 18, not permitted as explained earlier. Again, we expect the number to change. Now, admission to RIMC, Sainik School, military school, these are the kids who are at the age of 12 years, 13 years. Again, definitely, ethically also, we should not do a refractive surgery. And in this scenario, again, not permitted if it has been done. Aviation. Direct entries, again, these are people who are going through NDA. So again, the age is less than 20, not permitted. Lateral entry after 20 with some caveats, I'll explain later, it is permitted. Now, minimum age as per visual standards of armed forces is 20 years. So any LASIK done before 20 years, not permitted at all. So people who are coming to you for refractive surgeries, please note down the date they have come to you, keep their records, because when they come to us for medical, we definitely check what was the time, what was the age at the time when the LASIK was done. Now again, another criteria which is there is minimal 12 months post-surgery. The reason is this gives time for the regression to stabilize, the number to stabilize, any complication which is there is evident. So again, anybody who comes to you that I have a medical after 3 months, please do my refractive surgery, please don't do. Because again, the date of surgery is checked, and if it is less than 12 months, the person is rejected in this criteria. CCT, understandable, residual thickness of 450, it is basically to take care of. And again, topography is done, so any ectasia has to be ruled out. And again, risk of ectasia in future also is taken care of. As I said, these guys have contractual engagement throughout their life. So again, any person who gets into army has a contract of around 20 years, 30 years, sometimes 40 years also. So that aspect has to be taken care of. So corneal residual thickness more than 450 micron. So when you are doing a refractive surgery, again see what is going to be the CCT post-operatively. If it is going to be less than 450, that person will not be made fit. Now, again, axial length less than 26 millimeter. This is again important. Again, it takes care of any corneal retinal degeneration later on. Now, what we want is a stable residual refraction of plus minus 1 diopter, including cylinder. So this is again important. So this is what we do, and definitely a normal healthy retina. So any person who's coming to you with lattice, which you laser and do a refractive surgery, please tell that guy he will not be made fit in armed forces, because anything in the retina will be a sure shot unfit or rejection. Now for soldiers, again, when they enter army, the age is 17 years. Again, as explained earlier, refractive surgery in any form is not permitted. And even if they join later on, again, they are at far-flung posts. We need younger manpower. They are more prone to trauma, and definitely the visual acuity required for them is definitely more. They are at the forefront of our war. So age criteria is one. Second thing is because of these criteria, soldiers at the level of soldiers, refractive surgery is definitely not permitted at all. Now, in Navy and Air Force, few conditions are there, and with that, again, one is pre-op refractive error has to be less than 6 diopter. Again, this is a criteria being given by us. Again, that is the reason why the pre-op records are checked. So anytime you are doing a refractive surgery for somebody who's going for armed forces, their pre-op records have to be seen. So this is one criteria. Age after 20 years or 12 years, uncomplicated surgery, stable post-op refraction, the same criteria is there. And optical biometry is done. This axial length of 26 millimeter is taken because it is a objective criteria which doesn't differ from person to person. And again, please, there are few more things. In Air Force, LASIK or refractive surgery is permitted only for ground duty branches and short service commission, only in transport and helicopter stream only. And in Navy, the people who have done refractive surgery unfit for submarine, people who are on submarines and Marcos, again, the chance of risk of trauma or extreme weather conditions, extreme pressure conditions are there. That is the reason why these guys have been kept out of preview of refractive surgery. And in air crew for Navy, only difference is that axial length required is less than 25 millimeter. This is again not taking chance with the retina or any extreme G conditions. That is where you can have retinal weak retinas may tear up. So that is the reason why the axial length is kept at 25 millimeter. So reason is, in Air Force and Navy, the standards are more rigid than Army. Reason is that it's highly specialized job profile. Any aberrations will interfere or risk their expensive equipment as well as the lives of the trained crew. And as I already explained, the physiological conditions are already extreme. That is the reason why it is kept. So what I advise to general ophthalmologists, that what I want to tell them that armed forces have trained manpower. and we are looking at every person who are coming to us with a high index of suspicion. Every person undergoes refraction. Topography is easily available everywhere. So any person who tries to bypass the system by undergoing any refractive surgery is caught very, very easily, because equipment and everything is there. And best part is we are looking at them with high index of suspicion. So again, orthokeratology is going on like anything. Again, it's a temporary thing, but we can catch it very easily, and because topography is available everywhere. So that is the advice. Please don't do ortho-K for people who are going for armed forces recruitment, because unnecessarily that person will be rejected. Then second thing is, don't do any refractive procedure before 20 years of age. Keep records of pre-op refraction as well as date of surgery, because this is again a very important criteria. Do PECKI fundus examination, axial length, and for all, and keep a meticulous record for all these guys who are coming for armed forces recruitment. And in the end, this is very important. What I want to say is, armed forces is a vital part of society, and our needs are different than most others. So all of us have got a social and ethical responsibility to not try and do things which harm these people and the organization later on. Standards are easily available with advertisements, so anybody who is coming to you and asking for a refractive surgery for anything, please check the standards which are there for that recruitment. It is available with the advertisements. And finally, I want to just convey the fact that most procedures are detected, and it leads to rejection in these guys. So please, whenever anybody comes to you for refractive surgery for armed forces, please go through these points. Things are better for that person also and the organization also. Thank you so much.
Thank you, Sandeep, sir, for very elaborate talk about the various LASIK and its other refractive surgery requirements in the armed